Hello, everyone. So today we're going to answer the question, will prediabetes go away? And I'm bringing this up because that's something that comes up often. People are diagnosed with prediabetes and they don't always understand what that means. So people with diabetes have a 3 to 4 times higher risk of heart attacks and a high risk of stroke. In addition, if the diabetes is not controlled, it can lead to eye organ damage affecting the eyes, the kidneys, and nerves primarily. 15 to 30% of people with prediabetes will develop diabetes within 5 years if it's not addressed. So the good news, though, is that many studies have shown that prediabetes can be reversed. So when someone has prediabetes, I'm usually excited that we found it as prediabetes, that it hasn't yet, developed into diabetes, because it's much easier to reverse. So today I'm going to be discussing how we can reverse prediabetes with lifestyle changes. And you're listening to Connecting the Dots with Dr. Ashai. I'm Lola Ashai. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. And here we offer an innovative medical alternative way to receive health care that is stress-free and that is focused on the patient. You can find out more about us on our website, www.intouchprimarycare.com. And if you live in Texas, you can actually schedule a free 15-minute consultation on our website. Okay, so let's get into it. Will prediabetes go away? Well, yes, it can, but that's only if it's intentionally addressed. And that's what I want to talk about today, ways we can intentionally address prediabetes with consistent, simple steps. So first, some background though. So prediabetes, how do we diagnose that? It's a simple blood test. It can be fasting or not fasting. If you fast, then the numbers we look at your fasting glucose levels, which should be less than 100. So prediabetes or impaired fasting glucose is diagnosed if your fasting glucose levels are between 100 and 125. That level is primarily driven by what you ate for dinner, if you're fasting for about 6 to 8 hours. But the other number that is a little bit more accurate, especially as long as you don't have certain conditions like anemia that can affect the A1C. But usually, if the A1C is usually a better test for most people, and that is A1C between 5.7 and 6.4. So it's important that the A1C is put into context, and this is where having a doctor that knows you and knows your history and understands what's happening is important, because if you have certain conditions that affect the A1C, you may think your A1C is normal because it falls in the normal range, but if there are conditions that affect that A1C, it may not be normal for you. So there are things like that need to be addressed as well. Okay, so what are symptoms of prediabetes? So some people with prediabetes typically don't have any symptoms, which is the problem, right? Many times it's found when we do your annual physical or routine screening checks, maybe at a health fair, and you may be told that your A1C is a certain number or your fasting glucose is a certain number, which is consistent with prediabetes. The problem is 9 out of 10 people that actually have prediabetes don't know it. So that's the scary thing, because if you don't know you have it, then you can't do anything to reverse it. And like I said earlier, 15 to 30% of people that do not address it will develop diabetes within 5 years. So the problem with diabetes itself is, even in the early phases of diabetes, most people don't have symptoms. Many people will have symptoms in the later stages of diabetes, or if they have severe hyperglycemia, like when their blood sugar goes really high. But majority of people with even full-blown diabetes would not have any symptoms. So that is why doing the simple blood test with a doctor who knows your health history is important. Okay, so will prediabetes go away? So we mentioned earlier that it's possible to reverse prediabetes with lifestyle changes. And looking at this, there's a meta-analysis of 339,000 subjects in over 300 randomized controlled trials. And what they did was they compared mortality outcomes of exercise versus medication. And they found that exercise was as good or even better than medication in treatment of prediabetes, amongst other things. So we know that by an exercise plan, it is possible to reverse prediabetes. In a study done by the National Diabetic Prevention Program, they followed 3,000 people with impaired fasting glucose over 3 years. And what they did is they did structured aerobic resistance training or both. And they noticed that all those three, whether they did structured aerobic exercise, resistance training exercise, which is, resistant bands or light weights, things like that, anything to strengthen your muscles, or if they did both, any of those were associated with lower hemoglobin A1Cs. Exercise training of 150 minutes per week, which is about 30 minutes of exercise per day, was associated with greater lowering of the hemoglobin A1C values. So if you're able to do a little bit more than 30 minutes of exercise per day, or 150 minutes per week, if you want to do like 1 hour, 3 times a week, that can work too. But the point is, by regular, consistent exercise, people were able to reverse their prediabetes in a significant way. And multiple studies have shown this, that it's the consistency and then adequate exercise. It could be resistant training, it could be aerobic exercise like walking, swimming, running, or it could be both. And all of those things, physical activity improves A1Cs. And this is because exercise does it in many different ways. First, it increases the glucose utilization, because when you exercise, then you burn more calories, right? It also allows the glucose to be transported into the cells more easily. It increases insulin sensitivity. It decreases, so it makes it so that the beta cells that make the insulin don't have to work as hard. So that makes a big difference too. And then it helps the transporters that transports glucose into the cell work better. So there's so many things that exercise or physical activity does that affects blood sugars, that it's really, really important to incorporate that in your day. And so it is possible if you want to start now. This is September. A lot of times we've made health goals. This is a great time to start so that by the end of the year, you could reverse your prediabetes. Okay. Other factors affecting prediabetes is what you eat, obviously, right? And I addressed this on a previous video, and please check out that video. I believe is episode 9 on the YouTube channel. And we talked about, specific foods, but just a quick overview. Basically, you want to eat carbohydrates, but carbohydrates from whole grains, vegetables, and fruits mainly. So whole grains like whole barley, brown rice, popcorn, whole oats, whole grain. So basically, if you stick to more whole foods in terms of your carbs, and instead of processed carbs, which is what majority of us tend to eat, the problem with processed carbs is they have a lot of fat and sugar and sodium, and all those things increase insulin resistance, and so that causes problems. The other thing is with the other food group that is helpful with prediabetes are fats, and it's the polyunsaturated fats, though, so not, real, not saturated fat. So polyunsaturated fat, so like cold water fatty fish, so like salmon, sorry about that, like salmon, like mackerel, like tuna, nuts and seeds all have polyunsaturated fats that are pretty good for us and to reduce inflammation instead of saturated fats. And then the last food group is plant protein. So peas, beans, all kinds of beans, peas, lima beans, pinto beans, white beans, black beans, all those are good in terms of good protein sources to help with that you can eat. So basically, if you substitute avoiding animal protein and substitute with plant protein mainly, that or reducing animal protein and substitute with plant protein will be helpful. So exercise is huge with prediabetes, but with the dietary changes that we make are also really important. Carbs, whole grains, fruits, vegetables, fats, unsaturated fats mainly like fatty fish, nuts and seeds, salmon, mackerel, and then protein mainly from plant sources instead, and reducing animal sources as much as possible. So that's what, one can start working on today so that by the end of the year, you are free from prediabetes. And these lifestyle changes are great for not just prediabetes, but many, many other conditions. So if you're in the Houston area and you're looking for a doctor that is proactive about your health, you can check us out at our website, intouchprimarycare.com. You can schedule a free consult on the website, or you can call us on our number also listed on the website. Also, if you found this helpful, please share with someone, even if you learned just one new thing, so that it could make a difference for them as well. So many people feel like, they have prediabetes. Sometimes people take it for granted. Oh, my A1C has been the same for the last 5 years. It's okay. Or other people just ignore it. But prediabetes can lead to diabetes, and diabetes has serious, significant health implications. Additionally, it usually has a lot of cost implications. So it's really worth taking the time to address prediabetes in a holistic way, because it reduces your need for medication. It makes you healthier overall. And so it's like a win-win situation. So I hope that helps. And I will see you again next week at 2 o'clock for Connecting the Dots with Dr. Shai. Have a great day.